Good day, good day. This is Rachel Poe, known as Queen Rachel.
This was Rachel Pope before she contracted COVID-19 in November 2021. An accomplished painter, sculptor, and a playful makeup artist.
Well, I was very extremely active in the community, doing a lot of volunteer work, artistry work, using art to help bring community together.
But for almost a year, Rachel has struggled with a condition known as long COVID. And what's your life like now?
It's hard because these conditions that come on me is unpredictable. And it's like if I make an appointment for the doctor, I force myself to go. But if it's anything else, I cancel it because it's not worth it.
The virus hit her hard last year, landing her in the hospital. The initial COVID infection passed, but she could tell something wasn't right.
Wobble when I walk for balance, and along with tremors that comes when it wants to come.
She also had trouble with breathing and fatigue, and she suffers from what many experiencing long COVID call brain fog.
It's like I know I'm supposed to do something, and I sit there spaced out.
She usually doesn't allow people into her apartment, a place she calls her peace zone. But after taking us in to see some of her art, it quickly becomes overwhelming. Listen, I see you getting shaky as we talk, standing here. Do you want to sit down?
Yeah.
Yeah, sit down. Even just. Dennis Nash is researching long COVID at City University of New York.
Long COVID is a set of debilitating, persisting symptoms that develop well after the acute phase of COVID.
There's still much to learn, but Nash says people of color, who often have less access to top medical care in the U.S., may end up suffering more than the overall population.
I expect to see where we have more infections happening in minority communities, we'll begin to see a much higher burden of long COVID over time. When people have less access or more limited access to the healthcare system, they're going to have less benefit from the innovations and the new treatments that come available over time. And that's really, that will be another unfortunate, inequity that happens as a result of this pandemic.
Rachel Pope says she often feels invisible in the U.S. healthcare system.
As a Black woman with long haul COVID, I feel like I've been put at the bottom of the barrel and I got to do all the work.
There are no specific treatments for long COVID, so it's often a matter of managing symptoms. For Rachel Pope, that means focusing on diet and a holistic approach to her physical and mental well-being. She spends much of her time on this small patio, an oasis away from the world and from her own health struggles. What are your hopes moving forward?
My hopes and my determination is to get through each one of these symptoms one piece at a time and have a little piece of normalcy and get back being the artist that I used to be.
Jim Spellman, CGTN, Capitol Heights, Maryland.